Yeah, I feel awkward when you're watching.
I'm not watching, I'm talking to someone. I gotta turn my phone
So,
off.
hello everybody. I am actually at the infusion center right now getting IV iron. Yay for me. Being that October 20th is Mast Cell Disease Awareness Day. I had posted on my Instagram for a list of questions to do a Q&A, and since I'm just sitting here doing nothing, I figured I would try to answer as many as I can. Have them right here. I have other videos that explain exactly what mast cell is, but if you're watching this, I'm assuming you do know what mast cell disease is. But to preface this video, I guess I'll give a quick summary. There are a few types of mast cell disease. There is mast cell activation syndrome, where there are a normal number of mast cells in the body, but they trigger very easily. They release their chemicals when they get triggered, and these chemicals are called mediators, and the mediators consist of histamine, prostaglandins, cytokines, and those are what make us sick and give us symptoms. Then there is systemic mastocytosis, and in systemic mastocytosis, there are too many mast cells in the body, and because there are too many mast cells, those mast cells are constantly releasing their mediators too, and when there are an overabundance of mediators throughout the body, you are inevitably going to have symptoms. I have mast cell activation syndrome. I was diagnosed when I was 13. Well, the first evidence of a mast cell disorder was found when I was 13. This disease has been very difficult to live with. I am on a continuous diphenhydramine infusion, and I've made a video about that in the past. I have a number of triggers there. I can't really go out in public all that much because people's perfumes, laundry detergents, colognes, lotions, strong cosmetics, the chemicals that make up those products can cause severe reactions or even anaphylaxis. You can react to different temperature changes, hormonal fluctuations, just because. Now I will get into the questions. So what are the symptoms? So you can obviously have anaphylaxis, which is a life-threatening allergic reaction where your throat swells and your airway begins to close, or you go into cardiac distress. Other symptoms include flushing, where your face will get red, itching, swelling of your hands, feet, eyes, throat. You can have a cough. Did I say hives?
I don't know. I'm not listening.
Nausea, vomiting, diarrhea, bloating. People have seizures, dystonia, bone pain. Bone pain is a very big one. Blood sugar problems, problems regulating your blood pressure, fainting, syncope, liver and spleen swelling, bladder cystitis. Mast cell can cause anything and everything. What were my first symptoms? My mast cell activation syndrome, what we assume is caused by a genetic condition called Ehlers-Danlos syndrome. And the theory behind that is that because mast cells live in areas of collagen, and Ehlers-Danlos syndrome is a genetic condition which impacts the collagen, the mast cells become faulty because my collagen does not function properly. So I've had symptoms since birth, since my issue is genetic. But I would say, other than slight sensitivities, skin reactions from like different perfumes and that sort of thing, I didn't truly start getting noticeably ill until I was around 12 or 13. And my main symptoms then were not obviously allergic. I was having mainly GI symptoms, severe diarrhea, which was when I was diagnosed with mastocytic enterocolitis through a lower scope, and that was the first evidence of a mast cell disorder that they found. And I was having nausea, the diarrhea, and itching. I thought my itching was more seasonal allergy related, but I would call my mom from school, having her bring me a Zyrtec.
Math class.
and math, 7th grade math class. What is your worst symptom caused by mast cell activation syndrome? Oh my goodness. What is my worst symptom?
They're all equally
Yep,
bad.
they're all terrible. My least favorite symptom, I would say, is tachycardia. I can't stand tachycardia, and I am traumatized because when I had my first severe reaction, I was 17 years old. I had taken a medication incorrectly. Some of the powder had spilled out in the mucosal areas of my mouth, and those areas are filled with mast cells, and the excipients from that medication had caused a reaction. And after I had that first reaction, things just kind of snowballed, and I was having one after another after another. I didn't last very long at home after that. I had ended up losing all tube feeds, all foods, even water was causing me to go into these severe reactions. And each one was getting worse than the one before it. And my pulse during these reactions was going crazy. Sometimes it would be extremely low, like I had a nurse having to stay in my room all night turning off the monitor because my pulse was going into the 30s. And then I've had where it's up over 200, and I just can't stand that happening. Do you get blood pressure drops, swelling, and tingling around the mouth with mast cell activation syndrome? Yes, you can have all of those symptoms. Your tongue can go numb. That happened during my first ever full-blown reaction. That's how I knew something was wrong, was my tongue went numb.
And when you had salt that one time,
Oh, yeah.
you had tingling.
Another time when I was able to eat food, I put salt on my sweet potato fries, and instantly when that salt came in contact with my mouth, my tongue went numb, and then it was all she wrote. My blood pressure tends to go high more than low, but I do have occasions where it drops or it goes high and then drops. Who diagnoses mast cell activation syndrome? Now this is a tricky question because so many different specialties can play a role in the management of mast cell and the diagnosis. I was technically diagnosed by GI, but allergy and immunology typically is, I would say, diagnosis is the most frequently, and hematology oncology can also manage and diagnose mast cell activation syndrome. What was the testing like? The testing depends on what exactly they're looking for. If they're suspecting systemic mastocytosis, they will do a bone marrow biopsy and blood work. In the blood work specifically, they're looking for a tryptase level that's supposed to be elevated. But in mast cell activation syndrome, the bone marrow biopsy is clear. You will not find an overabundance of mast cells in that bone marrow biopsy. And the tryptase level is typically low, although there are cases of mast cell activation syndrome where it will rise after a reaction or it will stay mildly elevated all of the time. But that is not the case. My tryptase is a 2. Always been a 2. I've been tested in the middle of anaphylaxis, and it's a 2. For mast cell activation syndrome specifically, they tend to run 24-hour urine tests to test the mediators that the mast cells are releasing. And this is histamine, prostaglandins. You can even test different blood levels for heparin, and histamine and prostaglandins also have a blood test, which was how I was diagnosed, was through the blood. The urine is more accurate because it gives the whole picture of over a 24-hour period, whereas the blood levels will only give you the mediator level that very second the blood was drawn. I just so happened to be in a huge flare. I was inpatient receiving my Benadryl infusion because I couldn't quit going into anaphylaxis for that, and that is when I received the official diagnosis of mast cell activation syndrome, and Dr. Lawrence Afrin, which I'm sure everybody knows, is the one who had advised my doctors on the particular testing to run. They didn't want to do the 24-hour urine test because that had been attempted so many times before, and those urine tests are so overly sensitive the urine has to be kept at a specific temperature at all times, even during transport. And if the lab that is being sent to is out of state, which it was in my particular case, it's not necessarily a transporter's or a courier's top priority to keep someone's urine a specific temperature from Florida to Minnesota lab. So where did you go for your diagnosis? I didn't go anywhere for the actual diagnosis. I stayed in my home state of Florida with the GI doctor, and then years later the pediatric intensivist. But I did travel to Minnesota to see Dr. Afrin.
Well, it was
for
Dr.
management.
Afrin that told them what tests to do.
Yeah, they were conversing with Dr. Afrin from afar.
Yeah, otherwise you would not have gotten the diagnosis from Florida.
How is mast cell disease treated? Is Benadryl the only helpful medication? No, Benadryl is not the only helpful medication. There are tons of other medications that are tremendously helpful. But when someone is first diagnosed or suspected to have a mast cell disorder, typically the physician will advise to go to CVS or Walgreens or your local drugstore, pick up an over-the-counter H1 and H2 blocker. The H1 blockers consist of Zyrtec, Claritin, Allegra. Those are non-drowsy. You can take those for everyday maintenance in combination with an H2 blocker like Zantac or Pepcid. And if those are helpful, then chances are you probably do have a mast cell disorder going on. In very sensitive individuals like myself, you do not tolerate over-the-counter medications because there are too many inactive ingredients that provoke reactions. So in that particular situation, the physician would write a prescription to have whatever H1 non-drowsy H1 blocker you are on compounded, which at a special pharmacy, and that pharmacy will make that drug with a safe filler because they have to have enough bulk added to the regular drug powder to add to a capsule. After H1 and H2 blockers are added, a mast cell stabilizer like cromolyn sodium or Gastrocrom is a miracle medication for many people. In my case, it's a joke. Cromolyn is one of those medications that induces a flare prior to making it better if it is even going to work. I was on it for a period of time and it only helped one symptom that I noticed, which was the dry, irritating cough that I would get from scent triggers. Cromolyn coats the GI tract. When it's taken orally, very little of it is actually absorbed. It just acts as a topical, but it can cause the cells to degranulate at first as your body is adjusting to it. There's also a nebulized version of cromolyn, which the higher percentage is absorbed, and I trialed that, and that was a complete disaster. If there's one thing I regret, it's trying nebulized cromolyn, actually, because I never recovered from that particular setback, and I was coughing up blood for months. It was just not a good. I kind of lost all food after that. In the cases of mastocytosis or very severe presentations of MCAS, they can do chemotherapy-like medications. The chemotherapy for mast cell activation syndrome typically isn't the first go-to because it's just not, you kill off all the cells, but because there's not too many cells in the body, it just doesn't make sense to do a full chemo like you would for systemic mastocytosis.
Lost your door.
But there are cancer drugs like hydroxyurea and Gleevec, which is a TKI, that are prescribed for mast cell activation syndrome. I have tried Gleevec. It worked about 15% for me until I started reacting to it. At the time that I trialed it, it was not able to be compounded, so I was on it for about a month before it started causing reactions. Another good one is doxepin. That helped with bone pain for me. I was on that one for years. in years. It is an antidepressant, but it has antihistamine properties that are good for the mast cells. There is catatofen. You just gotta try things. There's Singulair.
That wasn't very good for you.
Yeah, I did Singulair and it didn't make me worse, but it didn't help anything. I noticed absolutely no difference with the Singulair. It depends on your underlying cause too. There's different immune drugs. Some people have success with IVIG, cyclosporine. Just, it really depends on what is the underlying cause of your mast cell activation syndrome. Has Benadryl affected your bladder function? That is a side effect of Benadryl, but no, I haven't noticed it impacting my bladder function at all. In my opinion, I think it makes it better because any bladder symptoms that are mast cell derived, the Benadryl will help. Have your doctors considered IVIG as a treatment option? Yes, they have. We've bounced the idea back and forth, but overall, at this current time, we have not chosen to pursue that because I do not display any evidence of having an underlying autoimmune cause for my mast cell activation syndrome. My ANA is normal. Back in the day, it used to be weekly positive, and because it's a blood product, the risk of reaction is very high. It is on the table, but right now I'm currently not undergoing IVIG therapy. For my HLH, we did consider that too, but that we're monitoring things a little bit more. My IgG subclasses, which can also be indicative of some kind of immune deficiency, which would warrant IVIG, those were normal too. Can you develop this at any point in life? Yes. Again, it depends on what initially is causing your mast cell disease. If you Lyme disease can cause it. So if you acquire Lyme disease when you're 20, then you end up getting secondary mast cell activation syndrome from it, then you're going to get it when you're 20 versus being born with it. Like if an autoimmune condition that develops later in life is causing your MCAS, then you will develop the MCAS whenever the autoimmune condition rears its ugly head. So yes, you can develop it at any time, whether you're fresh out of the womb or 60 years old. Can you grow out of it, or can mast cell disease go into remission?
It can go into a remission.
Yes, it can go into a remission. It doesn't mean you'll stay in remission, but you can go into a remission. I did have a spell of 10 months where, I was still taking, I guess I wasn't fully in remission because I was still taking medications, but I was much improved. I was able to eat, my feeding tube was removed, I was not dependent on IV medications, everything was orally. I was able to go out in public, go grocery shopping, yes. We don't even know what caused me to go back downhill again. The flare began in June, and by September I was on the Benadryl drug. With every other flare that I've had in my life, we could pinpoint, okay, this particular trigger is what caused this flare to become so bad or caused you to progress. Any tips for learning your triggers? Ignore the beeping. Unfortunately, learning your triggers is kind of a trial and error process. You don't want to just automatically assume that you're not going to tolerate something because so-and-so who has mast cell doesn't tolerate it. Yes, some of us we all have similar triggers, but sometimes there really is no rhyme or reason for what we tolerate versus what we don't. For example, when I was able to eat, a McDonald's hamburger was my safest food that caused the least amount of reaction. In the Oreo cakesters, those were really safe in comparison to if I were to go eat applesauce or something more healthy at the time. So, like I said, there can be no rhyme or reason for things. Obviously, you want to use your common sense and avoid the known mast cell degranulators, especially with medications, because those, once they cause a problem, depending on your presentation. It could take a very long time to get back to your baseline if you do. Lastly, what were the most useful resources you found for learning about mast cell disorders? I think mastattack.org is very, very helpful. Reading scholarly articles and published journals about the disorder online, talking with others who also have the condition, all of those are very, very helpful resources. And I've got to go attend to this because my infusion is done. So thank you everyone for watching. I hope this video sheds some light on mast cell disorders. At the beginning when I was saying how this disorder has really impacted my life and I can't go out much and discussing the triggers. Another way that this has impacted my life is that my family can't even cook in the house because the food proteins from the foods cooking, when I'm exposed to those for long periods of time, those tend to trigger. We have a kitchen in the garage.
Yeah. Before that, it was becoming quite expensive.
They can eat things in the house that aren't cooked, but it's the cooking process really that gets me.